A facial plastic surgeon typically is someone who has completed an ear, nose, and throat residency and then go on to do an area or an extra training of subspecialty in facial plastics and reconstructive surgery. I deal with the aesthetics, I also deal with the reconstructive, and I think what that lends to in the umbrella of plastic surgery, a facial plastic surgeon spends all their time in this area anatomically, from the moment he or she stepped into a residency program to when they completed their fellowship. So you're in this anatomy constantly, and I think that provides an advantage to the patient just with the familiarity of the anatomy, as well as the fact that you really take form and function in perspective. So not only are you dealing with something aesthetically, but you're making sure that you're optimizing the functional capacity as well. I like to refer to my toolbox. Okay, so what are we trying to achieve? What is in my toolbox to help get us there? And in addition to what's their expectation from a downtime perspective? How busy is their lifestyle? How much time does the patient have to take off from work or their busy social schedule? Especially in this area, the community is just so active. And you put all that in perspective. And then you have that face-to-face interaction where you kind of say, well, here's what we can achieve, but here's what it costs you from a time perspective and an economical perspective as well. And we kind of come up with a game plan. Maybe surgery is not an option for them because of medical problems. But that doesn't mean you can't do something to enhance how the person looks and make them feel better about themselves. Art and symmetry are key characteristics in what I do. And a lot of it is, again, it's a conceptualized idea or picture that you have in mind, and you have to look at someone as a canvas. And when they come in, again, expressing what their expectations are, what they'd like to achieve, you have to kind of come up with a realistic game plan. And sometimes I'll tell them, you're not a good candidate for something because you can't fight genetics to a degree. There's things that you can control, there's things you can't control, but that's where the art part of it comes into. It's the art of medicine, it's the art of surgery.